An interview with Diane Millar, RDH, on reinforced periodontal instrumentation. I'm here today with Diane Millar from California. Thank you, Diane, so much for joining us here on Dental Hygiene Quarterly.
Well, thank you for inviting me. I'm honored to be here.
Wanted to ask you, what is it that you present? What makes your presentation very different?
Well, I teach dental hygienists how to have career longevity by using reinforced instrumentation techniques. And what that means is you have an instrument in your hand and you use your dominant hand, as you normally would, to scale, and your non-dominant hand to press on the long terminal shank and bring both hands together to implement your scaling stroke. And the reason for that is because the non-dominant hand helps to protect the dominant hand while scaling and also implements the larger muscle groups in the arms to activate the stroke with pull strokes instead of wrist rocking strokes.
So would you do this throughout the entire dentition? Is that the way you would do all your instrumentation?
Yes, that's correct. However, on the mandibular arch, there are some areas using the 13-14 where you have to use some wrist rocking motion. However, that is limited. So we try to use pull strokes with this technique to prevent repetitive motion injuries with wrist rocking side to side or up and down strokes.
So Diane, what makes you have these instruments here with the LM?
Well, LM Dental makes instruments that are silicone handles, and the handles are much wider than your conventional stainless steel instruments on the market. And studies have shown that when you have a wider handle to grip to, your grip force isn't going to be as problematic with your ergonomics as if you had a smaller handle with grip force.
Right.
So I like the LM Dental ergonomics handle because I can then hold on to the instrument and not feel like I'm going to cause injury or pain, and it's more comfortable because the silicone handle has a little bit of a give to it.
And they're lighter.
They're
Now,
lighter.
I've heard along the way that it's good to switch it up. So they have like a larger one as well. They have the regular size here, but then they have the even larger one.
That's correct.
So is that something that you, or is it just use a larger handle, or is it go from one and you can go into a larger one and that's even better, or does
So
it really matter?
yes, it does. This particular size handle is about 11.5 millimeters, and
Okay.
the ErgoSense handle is even larger at about 14.5 millimeters in width. And so it takes a little bit to get used to having a little bit of a larger handle when you're used to using a smaller handle. However, it doesn't take long because of the comfort zone that instantly occurs with having a larger handle. It's like when you use a pen. If you have a pen that
Yeah.
has a very small handle to it, it's not as comfortable as having a wider handle that has a little bit of a give to it.
I
So
can't use a thin pen anymore.
no, absolutely not. When I was in dental hygiene school, we had to use instruments that were 2 millimeters in width, like
Oh
a
my
thin
gosh.
pencil.
Yes.
So it's really nice that this company offers this particular kind of handle, and because of that, I use their instruments in my workshops and highly recommend them. I have my students try them out at West Coast University, and the exposure for them to know that there is a wider handle on the market that's safer for them is really important.
And lighter. That's great. So Diane, how difficult is it to get used to not using the mirror? We're always so used to putting the mirror in our non-dominant hand and the instrument in our dominant hand. So making the switch where you're using both hands to do your scaling, how are you retracting? How are you positioning yourself so that you can see what you're doing and get access to all the areas that we need to access?
That's a really good question. Most dental hygienists are very comfortable using an instrument in one hand and a mirror in the other hand. However, in dental hygiene school, we do learn how to retract the buccal mucosa and use extraoral fulcrums without the mirror.
Right.
And so with that exposure, it's just taking it a little further and learning how to position the patient, learning how to position yourself, wearing loops and lights so that you don't compromise and have to turn your head in awkward postures in your body as well. So it all comes together. Usually in my workshops, the very beginning, hygienists can't even imagine not using the mirror. By the end, they don't even want to use a mirror because they see the advantage
Right.
of being able to use direct vision, properly positioning the patient and themselves so that they can see. However, loops and lights are really important so that we can stay neutral and not have to get too close to the patient, as I mentioned, and compromise.
Right. I see that you have written a book, which is amazing. I wrote a chapter in a textbook for somebody in the States, and it took so long to do a chapter. I can't imagine creating a whole book. So this is wonderful. And so do you want to just talk a little bit about the book and what's in there? And
Sure. Well, when I started doing lectures, attendees would say to me, how are we going to remember this? How do you expect us to take all this information and be able to remember it? And so that prompted me to starting to write articles. And then I wrote this book. I wrote a manuscript, actually, and I figured, well, I'll submit it to a publishing company. If they don't publish it, I'll self-publish. And Lippincott, exactly 10 years ago this year, they published this book. It came out in 2017. However, yes, it was very difficult. It took 2 years working with Lippincott to have this published, and they did a great job. I'm honored to be able to offer this to attendees who come to my lectures and workshops, and also there are students across the country, in the world, that are using it in the dental hygiene program that they're in. Also hygienists who are out in the field who have heard about it. They're having some difficulties. They're using it as well.
Great. So Diane, how would our members get a copy of your book?
Well, they can go to my website and go to the icon that says book at the very top and click on it, and it'll take them directly to the LWW.LippincottWilliamsandWilkins.com website, where they can purchase the book, or they can go to lww.com. But in order to get to my website, it's DianeMillar.com.
Very good. Okay, well, thank you so much. I'm looking forward to seeing the demonstration that we're going to do next.
Okay, so the reinforced technique essentially is such where you use your dominant hand to scale the normal way that you would. The non-dominant hand, however, comes in and supports the long terminal shank, and pull strokes are implemented. Then both hands come together, thumb to thumb or palm to palm, to initiate the strokes. Again, I insert the normal way I would. The long terminal shank is parallel to the long axis of the surface I'm scaling. I'm going to hold on to the long terminal shank with my index finger, bring both hands together, and then initiate the stroke with pull strokes. So both hands are working together. If I'm going to be scaling the mandibular lower left quadrant buccal surfaces, I can be seated at 1 o'clock and drop in opposite arch with my instrument onto the mesial surface, holding onto the long terminal shank, bringing both hands together, thumb to thumb, and then initiate a pull stroke where both hands are moving together in unison. And I'm using the larger muscle groups in my arms in order to scale in this area.
So thank you so much, Diane, for being on Dental Hygiene Quarterly. We really appreciate you sharing your expertise with us.
Thank you. I enjoyed being here with you. Thank you so much.
An interview with Diane Millar, RDH, on reinforced periodontal instrumentation.